It's fall, which means three things for most of us. Raking leaves, being annoyed by holiday decorations being up way too early, and open enrollment. Hi, my name's John. I'm your healthcare hacker. In this episode of Healthcare Hacks, we want to explore what plan should you pick when your employer offers various options during open enrollment. There's typically two types of plans. The first is an HMO or PPO. They're defined by high monthly premiums, but low deductibles, and then you pay co-insurance and co-pays until you hit your out-of-pocket max. And the other side is you have high deductible plans. Now, with them, you have low monthly premiums, but you pay much more in a deductible. So your first dollar isn't covered until you hit that cap. And then you hit co-pays and co-insurance to hit your out-of-pocket max. So which one do you choose? What's the right answer? All things being equal, I would always choose a high deductible plan. And let me tell you why. First off, the high deductible plan has something called a health savings account, an HSA, where you can put tax-free dollars into it to fund your healthcare. It's your account, it rolls over. You can use it this year, next year, when you turn 65. As long as you use the healthcare dollars, you never pay taxes on it. And you can add to it each year. If you're a young, healthy family, take the high deductible plan, because at the end of the day, you're gonna be saving money by paying a lower monthly premium, and you can put it away. If you have a chronic condition, you're kind of in the middle. You're gonna spend less than $10,000, but you're gonna have some substantial costs. Maybe you or your spouse are gonna have a baby. Then it may make sense to do the PPO HMO option. Now, in that option, you are gonna pay more per month, but you're going to pay less when you do have that care. If you have something seriously wrong, you know you're gonna have a knee replacement, you know your back's been bothering you for several years and it's probably time to have that surgery. Counterintuitively, now this made no sense and I didn't believe it until I crunched the numbers, you should get the high deductible plan. And here's why. The out-of-pocket maxes are almost the same between the HMO PPO and the high deductible plan. So you're gonna pay the same amount. Well, the difference is that HSA. HSA is tax-free. So you're gonna save tax dollars by using that to pay some of your deductible. End of the day, there's no simple choice. You gotta crunch the numbers, know your family, know what your healthcare expense is going to be. And also, one final caveat. If you have a doctor you go to on a regular basis or your local hospital that you want to stay at, make sure that they're in network. That trumps any other decision. If that doctor or hospital is not in network, you're going to end up paying more next year, regardless of what plan you have. If you have questions about how to save money or problems you're facing with healthcare dollars, email us on the address on the screen.